India is in the middle of a humanitarian crisis. Our national capital, Delhi, is in the middle of a huge health crisis. There are no beds available for COVID patients anymore. I went down to St. Stephen's Hospital in Delhi this morning to meet the legendary Dr. Mathew, once the director of the hospital, but now just a legendary orthopedician, a person with a particular view of the need to invest in public health. I'll just reinforce this point because the reasons why we find ourselves unable to cope in the city, and this is before the workers reach the villages where there is no public health. I would just want to put out a couple of data points before you. India between 2000 and 2015 spent an average of 3.8% of its GDP on public health against the international average of 10% of GDP. 70% of health expenses are out of pocket for poor Indians to the private health sector, which means people get pushed into poverty because we have not created a public health system. This is an urgent thing for us to understand, to demand that in the future governments start reinforcing public health. And no governments of India from the time of independence have done so adequately. Be it Congress, be it BJP, they just have not invested in public health. They've just given a small amount to public health. So I start off talking to Dr. Verghese by asking him about the lockdown. Over to him.
Lockdown is only for preparing your healthcare facilities, training your staff, building capacity, getting ventilators ready. When it is not available, the PPE is to be procured and stocked up and planned for a long haul. Lockdown is only for preparation and nothing else.
So right now, I repeat, are we in an emergency situation in Delhi?
We were in an emergency situation right from the day the pandemic was announced, March 11th. Right from that time, we were in an emergency situation, and we continue to be in an emergency situation. Is the crisis worsening? Yes, because as time goes by, we have fatigue. Our health systems get fatigued. The staff, doctors, my medical department, they are tired. They are tired of doing the rotas. It's not easy wearing the PPE and working with PPE. It's a total fatigue that is setting in. That's number one. The number of cases, they have gone up dramatically. If you look at the statistics, it's really gone up dramatically. However, if you still see the mortality, India is 5 per million population. Compared to Europe, is anywhere between 200 to 200, around 287 also in the UK, to about 800 something in Belgium, which is the worst. So compared to that, we are pretty good. But we are in an emergency situation.
So the kind of patients that are getting corona now, we the rich bought them through our international efforts. Are they the poor? Do we have a profile now, or is it from all over?
Now it's all over. You see, you allowed them to mix all over.
So community spread has happened.
The poor, where did they get from? They got it from their drivers, the security men, the housemaids, the helpers, the housekeeping. They got it from the rich. They didn't get it from here.
Absolutely, yeah. And so our entire policy, be it public health, be it anything, has been very insensitive to the needs of most of our population. Would you agree with that?
That we have been arguing for a long time. That you need to have a basic healthcare infrastructure robust. Germany has managed well. South Korea has managed well. Canada has managed well. That is because they have good healthcare infrastructure. Japan, they have had spikes, but they are managing very well. They have a very good public health infrastructure. And there, mind you, I am not talking only about primary care. People do not understand this. When you improve primary care, the need for secondary care increases. When you improve secondary care, the need for tertiary care increases. So you don't just improve primary care as a lot of people say, improve primary care, the secondary care and tertiary care should go to privatization. Forget it, that's nonsense. The government public sector should have primary care, secondary care and tertiary care built up robustly. Your mess now is because you allowed privatization of secondary and tertiary care and focused only on primary care, which is also not good.
Absolutely. So the last question I have for you, you're a legend in medicine.
Oh, I don't know that.
And today you are saying if you make a call to any hospital in Delhi, there is no bed available with a
I have
ventilator.
used my contacts and they are all very respectful. They tried their best and called back saying that, sorry Mathew, if there is anything falling vacant, we'll let you know.
My God, thank you so much.